Hi all, welcome back. In this video, I am going to explain about how to remove aligners hassle-free. Initially, in first few days of aligner treatment, patient may feel difficulty for removing aligners. And yes, they have to remove whenever they have meals or snacks. But it will be fine in another couple of days with some of these factors like 1. Aligner gets more flexible. 2. Patient will learn how to remove it. 3. Teeth starts moving. And this video is to overcome those difficulties. The main reason why aligners restrict to come out is because of attachment, which is located on the outer side of the teeth. To prevent this restriction, we can start removing from the inner side of the teeth. And the free end of aligner is at backmost portion of the teeth, which comes off easily. Hence, start remove aligner from inner side and backmost portion of the teeth and push it outward to disengage from attachment. Repeat the same procedure to opposite side of the arch. Once the aligner gets disengaged from attachment, can pull off aligners from the front portion of the teeth. You can use this retriever, which helps to hook the aligner properly and pull off from the posteriormost area of the teeth. It's all patient's comfort whether to use retriever or not, but should be gentle while using retriever. Excess pressure may create sharp edges on aligners. For more aligner tips, stay tuned with Pristine Aligners.